This hospital developed from a small clinic into what is now a 45-bedded hospital, and which has facilities for inpatients with general medical and general surgical problems, as well as patients who require TB treatment. So it's kind of split up between two halves, general patients category as well as TB patients.
Tibetan Delek Hospital is a registered charitable hospital, and we have at present 37 staff. And the main source of our income is through individual donors and the minimum fees that we collect from patients.
Delek mengangi thoniya ene nebazolya tagcheda menje nayedi dharamsala yebigi pheri 대대신기 다람살에 예비기 자가라 유미 엔다가나시 지자칸의 배비기 유고 도전바 근데 망부질이야 근데 델레맹가 토니야 menjo다 menjo 토리야 네파타제 나야레 디게 돌아 두고 시기요레 아니 조다칸이야 조데바 디게 디야 차장 지용들깔이야 간다지 만달이야 팅이 점지 대 조데기 버지 자기어레스 주의.
The standard of medical care the hospital provides is extremely good and very high, considering the restrictions you've got because of availability of equipment and things, and the rurality of where we are.
The hospital provides quite a wide range of basic services, starting from general medical consultations to emergency services 24 hours. We also provide dental services here. We provide laboratory services 24 hours. We provide antenatal services in the hospital as well as up in our outreach center also. There is also an ultrasonography and radiology services provided by the hospital. We provide upper GI endoscopy facilities, which is not available up to a distance of 80 kilometers from here. We're also the only institute here that can provide multi-drug resistance TB care in this community.
The TB care and people, particularly pulmonary TB, are extremely good. They're sort of a centre of excellence, both in the diagnosis and long-term management. There's a separate TB unit, so particularly good at that.
TB is probably one of our biggest concerns in this community, because the Tibetan people have 4 times more TB than the general Indian population. It is like a virgin population having very little resistance to this new disease in the community. This is one of our major burdens, and probably the number 1 killer disease amongst infectious diseases here. We don't receive any funding from the Tibetan government in exile, and therefore we are autonomous. We have a small funding source from income generation projects here in the hospital, which comes by some houses that are rented out to people who are tenants, as well as some shops that pay in their monthly rent, and that forms part of the resource. A corpus fund is also there in the hospital, from which a certain amount of interest is earned from the banks. But by and large, it's heavily dependent on donor organizations to pay the running costs of this hospital.
Delek mengangi 군대 만사지 지게 로족할이야 땡기고 여지 자교래 근데 대야 네 랑가라서 투비에다 딘데 요말에 만사 네 지게 로족하.
Dharamsala is a small mountain town. There are not very many affluent people living around, or big business corporates existing around here. There's not much industry around here. Therefore, it is very difficult to do fundraising within this community itself.
It's very difficult with the financially, because they're earning a day-to-day life they live, and their income in a year is almost nothing. So they live as day-by-day income as laborers.
If the patient is very poor, they have no money, we have to treat them. We never return even a single patient without treatment. And if they could pay, then we have to charge them the minimum fees. If they don't have money, then we have to treat them completely free, of course.
야자로 오지만다 야주 든주 야주지 편이 패대교 자 차대도 자마 안 콘주기 다지 편이 사와 패대도 자마 단대가래 변주기 내다 아니 시라기 강에 유대버지 다 랑식이 차들고 소소 고주색이 강범메도 자마라 덴데기 메링테 담맹 다제치야다 하도도 나서 도자 차부도 나도 자마
What we really do is we cut down a lot of overhead costs. We try to keep only very basic equipment here that is absolutely necessary.
We try to use minimum everything. Electricity we switch off except the emergency lights. Otherwise we switch off all the places where there is a light of the daytime. We never use the electricity.
So I think there is a spirit of saving and not overindulging and not utilizing facilities here in a lavish way or in a wasteful manner. The staff receive a salary that is far below what the salary levels are in Indian government hospitals. So there is a lot of sacrifice in terms of the staff here to earn less than what their Indian colleagues may earn.
It affects the patient's cost, you see. So we try to minimize that. We reuse we re-autoclave it, we reuse the gloves.
India is full of plastic water bottles that you buy drinking water in, but these are not just plastic water bottles. These can be used for anything. If you're draining someone's chest of litres of fluid, you put it in a plastic water bottle. If you need a sick bowl, it's a plastic water bottle. It can be a urine bottle. You can put false teeth in it. You can also use it as a filter, to hold the filter at, so that 101 uses for a plastic water bottle, I think could be a Delek publication. Yeah.
Here the staff are very much ingrained into that sort of attitude that whatever they use has a value. You know, it's being paid by somebody, and especially the fact that there are many people around the world who are supporting running the hospital, that we owe a responsibility to spending in a responsible way.
The donors who has donated money to our hospital, we account each penny to the donors, and we send a report to the donor, individual donor, and if it is an organization, we send reports to them.
An average patient who is admitted into the hospital will pay less than $1 for his bed charges as well as for 3 meals a day. And the only extra cost that he would have to pay is for medicines and investigations. He will not be charged for any consultation fees, and there's a bare minimum charge sometimes for certain procedures. Otherwise, the cost of a patient on an average stay in the hospital for instance, 5 to 10 days would normally be hardly more than 1,000 rupees, which is just equal to about maybe about $20 or $25. The hospital also provides free treatment for all the Tibetan government and exile staff, as well as providing free treatment for newcomers from Tibet for the first 6 months of their stay in India. And on an average, we have at least 4,000 to 7,000 newcomers coming each year, and they are given free treatment because the majority of them have no earning whatsoever, and many of them have left Tibet without any financial resource, and therefore when they come here, they are heavily dependent on the Tibetan government to provide them food and lodging, as well as employment, as well as education. So it is our responsibility to provide whatever is basically necessary for their survival in India, and that goes for health facilities too. From this newcomers group that arrive here, there is a school that has between 500 to 600 students who are between the age of 18 to 25 who study for periods of a year to 5 years in Dharamsala. And most of them have never received any education in the past, and it is our responsibility and to care for their health. Dharamsala also has established an old people's home that has more than 150 old people who live in there.
And our doctors, we go there every week to the old age home, and we do check up there.
And the hospital bears 50% of all the health expenses if they use and access the Delek hospital.
We at the Delek hospital not only concentrate only in Dharamsala, but those Tibetan settlements scattered in Himachal Pradesh, we have been looking after their health through our mobile team. And in each settlement in Himachal Pradesh, there is at least 1 or 2 health workers, and all of them are trained by Delek hospital.
We also provide a dental field group that goes out twice a year. So there are several mobile trips that we provide from here to care for the local Tibetans living outside Dharamsala also. The bulk of the population in Dharamsala is located up in McLeodganj. We run clinics there which are general medical clinics as well as antenatal clinics as well as TB clinics and physiotherapy clinics. So we have several clinics running there as an outdoor facility there in McLeodganj. So all in all, we do pay for a large number of people in Dharamsala, and most of it's given either at a very concessional cost or entirely free. I would like to appeal to all our supporters and donors that there are several ways that they can help. One is obviously providing for ongoing running expenses for which there is no secure and stable means which we can rely on.
But I think they're providing the best care that you could possibly get in these circumstances, and is more comparable with care in the West, and certainly is trying hard to maintain that standard, and they're doing it very well.
We need several equipments that would provide better diagnostic facilities here for the hospital. The TB patients who live here right now live under rather difficult accommodation, and we would like to provide them better facilities, better obstetric facilities here, whereby obstetric surgery can also be done and patients don't need to be referred out. It's very important for people to know why the Tibetan refugee population is still in Dharamsala. The prime purpose of being here is to struggle towards obtaining freedom for Tibet. And we consider this freedom to be so important that we are willing to hang on in Dharamsala and work towards that freedom, no matter what it costs. And this freedom in Tibet has not only got to do with Tibet, but has got to do a lot with promotion of human values in this planet.
I think Delek is providing impartial, good quality care. It's not simply trying to patch up holes. It is trying to actually provide a continuity of care and a quality service. And for that reason, I think it's providing a very valuable service, and it's worthwhile supporting. That's why I'm here.